Hi everyone. Today I would like to present an analysis on the legal issues in public health. My presentation will be looking at the public health mechanism in Malaysia by using the paper published by Stephanie Covell and Tanya Bubella as a reference. There are three things to be mainly covered in this analysis: the role of government in creating the conditions for people to be healthy, the reasonable limits that governments may place on personal freedom to promote the health of the population, and the responsiveness of governments to newly identified threats to population health. Let's take the current COVID-19 issue as an example. The novel coronavirus infectious disease outbreak was declared as a pandemic by the World Health Organization following the uncontrollable spreading of the disease across the globe. A number of preventive measures were mandated by international health organizations as well as the local governments everywhere. Along with that, many countries, including Malaysia, have enforced nationwide lockdowns and movement control orders in an attempt to break the chain of infection and flatten the pandemic curve. Although we understand the need to have such measures in place, there are still debates and dissatisfaction to how these enforcements or restrictions have affected the fundamental rights of the people. Can public health law do that? Well, yes. The mandate revolving around public health legislation is that it should at all time be in favor of promoting health as a common good, and when seen to interfere with individual interests, health must take precedence. Such claims have been established quite clearly in these given statements, one which is from the book published by Lawrence Augustin, and the other which refers to Article 25 in the Universal Declaration of Human Rights, 1948. It should not be considered that anything and everything can be passed as long as it concerns public health. Surely, different countries value individual rights and freedom differently, but as a ground rule, any government given the authority to establish relevant public health laws in times of need especially has to consider these justifications. First, what is the underlying importance and objective for such law and action? Second, whether the law or action passed is rationally connected to the objective. Third, whether the law restricts the right or freedoms no more than necessary to achieve the objective. And lastly, the proportionality of effect on individuals when the law is applied. In many countries, public health laws have been embedded within the national constitution, which is the highest law regarded within the jurisdiction. Such is the case for the successful building of a well-developed healthcare sector in Malaysia. In fact, the draft of this inclusion in the federal constitution even included the active involvement of the World Health Organization. And if we consider the current COVID-19 situation, it is clear that all the recommendations by WHO or World Health Organization have been observed by Malaysia, thus suggesting a top-down approach in terms of enforcement of COVID-19 interventions. In the recently passed bills during the 14th Parliament sitting, 3 out of 10 bills were concerning the pandemic. This proves that the Malaysian public health national policies are quite flexible to adapt to rising threats. However, it is rather unfortunate that the principal legislation, the Prevention and Control of Infectious Disease Act, was neither reviewed nor addressed during the parliamentary sitting. Similar to many other countries and their national health legislation, this Malaysia's Act 342 is to be considered as outdated since it has never been reviewed or amended from the time of its enactment. And if you look at the national immunization program against diseases like polio, rubella, measles, the recent report of a Sabahan infant being diagnosed with polio, a disease presumably eradicated in 1986, raises questions on the effectiveness of the existing healthcare policies in Malaysia. As of today, there are no mandatory vaccination orders issued by the Malaysian government. There has been an increase in resistance of accepting vaccines based on conflicts of religious beliefs as well as safety controversies. And there are non-citizens such as refugees, stateless people, and immigrants who might be the carriers of the diseases that has been under control in Malaysia. These issues obviously show that we have a long way to go to strengthen our public health front. In conclusion, a top-down approach with mandatory public health intervention is crucial in some cases, specifically one that concerns the well-being of the majority of the society. Public health laws are also not to be regarded as a one-off issuance or to be compromised without proper consideration in case of individual rights infringement. Instead, a thorough evaluation from the perspective of legal validation, equality and societal well-being, as well as national health sustainability should be considered prior to decision making. Moreover, to face new threats, latest technological advancements, scientific evidence, and the nation's economic status should be considered when drafting these legal standards to ensure that the functionality of these national legislations remain relevant and effective as part of the long-term preparedness strategy for public health emergencies or crises to be faced. Among the Sustainable Development Goals identified to be impacted by a nation's public health laws are firstly SDG 3, good health and well-being, which extensively covers the efforts of reducing mortality rate among children, communicable and non-communicable diseases, and supporting vaccination-based researches. Secondly, it's SDG 10, reduced inequalities, where equal opportunities for the people regardless of locals or immigrants to be given via an inclusive practice of legislation and actions. And lastly, SDG 16, peace, justice, and strong institutions, which is to promote and enforce non-discriminatory laws and policies to ensure public access to information and protect fundamental freedoms, as well as to ensure responsive, inclusive, transparent, and participatory decision-making process. Thank you.